Good afternoon and welcome to the daily Downing Street coronavirus briefing. I'm joined by Professor Chris Whitty, the Chief Medical Officer, and John Newton. Before I turn to the latest coronavirus data, I wanted to say something this Mental Health Awareness Week. I know how difficult the change and the uncertainty generated by this awful virus has been for many people. So many moments of joy have been put on hold, cherished milestones and important events, and time with loved ones, and things that were in the diary that you might have been looking forward to, but can't any longer take place. So I want to say this to anyone who's finding it hard. These are tough times. It is okay to be not okay. And it is normal to feel low and anxious and unhappy sometimes. But it is so important that if you think you need it, please seek help. If you want to talk to someone, please go to the NHS. It is there for you. And if you're a health or care worker, there's a bespoke series of support. So we can care for you just as you care for the rest of us. Just text frontline to 85258. Mental health charities are also offering some brilliant support. Today, I'm providing a further £4.2 million, so organisations like the Samaritans and Young Minds and Mental Health UK can keep doing what they do best. Everyone can strengthen their mental health, just in the same way that we keep our eye on our physical health, including when we're healthy. And the PHE's Every Mind Matters campaign is something that every single person can engage with and use to strengthen your mental health and well-being in good times and in bad. So let's all come together this Mental Health Awareness Week and support each other. Turning to the daily figures, we've now completed over 3 million tests for coronavirus. In total, 3,090,566 tests have been carried out in the UK, including 128,340 tests yesterday. 250,908 people have tested positive. That's an increase of 2,615 cases since yesterday. 9,543 people are currently in hospital with coronavirus. That is a 14% fall from the same time last week. Sadly, of those who tested positive for coronavirus across all settings, 36,042 have now died, and that's an increase of 338 fatalities since yesterday. This is a deadly virus, and it's brought pain to so many, both here and across the world, but we are making some real progress. And I'd like to take a moment to remind everyone about our plan to defeat coronavirus and get Britain moving once again. Slide 1, please. As you may have seen at previous briefings, we've now put in place our COVID alert level system. It consists of 5 levels based on the R value and the number of new cases. This alert level guides the social distancing rules, which have proved to be so effective at getting the virus under control. The higher the alert level, the stricter the rules. Now, throughout the lockdown, we've been at level 4. As you can see, level 4 means that coronavirus is in general circulation and that transmission is either high or exponentially rising. But thanks to your shared sacrifice, we've now brought R down. And because of this caution, we're in a position to start moving to level 3. Next slide, please. And here is how we can move forward. We've set out 3 steps that we plan to take carefully to modify the social distancing rules and start to restore freedom in this country, all the while avoiding a disastrous second peak that could overwhelm the NHS. At each step, we'll closely monitor the impact on R, on the number of new infections, and on all available data. We're currently at step 1, which means that if you work but you can't work from home, you should speak to your employer about going back in. You can now spend time outdoors and exercise as often as you like, and you can meet one other person from outside your household in an outdoor public place. but you should stay 2 meters apart. We'll move to step 2 on the 1st of June if we are able to do so. Step 2 involves reopening more things like schools and some retail, and using our test and trace system to keep R down. We'll only move to step 2 and then in due course to step 3 when it is safe to do so. Next slide, please. It's important that we stay alert and think about what we can all do to control the spread of the virus. This means, of course, staying at home as much as is possible, working from home if you can. It means hygiene. Washing your hands and cleaning surfaces remains absolutely crucial. Distance, staying 2 meters apart wherever possible. Protection, wearing face coverings on public transport and in shops. And self-isolating altogether if you have symptoms. And as we approach a bank holiday weekend, we must all renew our efforts. Over the course of this pandemic, people all across the UK have been making difficult but vital sacrifices for the greater good. So let's not go back to square one. We can all play our part in the national effort to get R down and keep R down and control the virus so we restore more of the things that make life worth living. As we follow our plan, our testing regime will be our guiding star. It's the information that helps us to search out and defeat this virus. Over the past few months, we've built a critical national infrastructure for testing on a massive scale. We've already put in place the building blocks. We developed the test. We built the test centers and the lab capacity. We created the home testing kits that give us, all this gives us clarity and certainty. We hit the 100,000 tests on time when we said we would, but we're always striving to go further. To expand our testing capacity and to improve our understanding of this virus, there are 2 developments that I wanted to share with you today. The first is around swab tests. These are the tests that tell you if you currently have coronavirus. As I announced on Monday, anybody over 5 who has symptoms is now eligible for a test. And getting a test is important, but getting a quick result is important too. We're working hard on innovative developments, and I wanted to bring you up to speed with this. Now, it's really important to be clear about this. Working with innovative science always has its risks. Like all R&D, lots of projects don't come off. And just like, for instance, vaccines, where we don't know if we'll ever get one, but I'm prepared to back innovative developments even if they might never happen. I think it's worth it. And I think it's worth it, especially in these circumstances, to back things before you know for sure if they're going to work. And I make no apologies for that. We're working with many top names to help us deliver testing with a rapid turnaround. Names like Oxford Nanopore and Chronomics and DNA Nudge. For example, one innovative company, Optigene, has produced an early test which is being trialed from today. And it is interesting to us because it is so fast. It doesn't need to be sent to a lab to be processed, and so you get the result on the spot, typically within around 20 minutes. It's already proven effective in early trials, and we want to find out if it will be effective on a larger scale. And we want to support companies like Optigene and others to develop these sorts of innovative projects. We'll monitor its effectiveness very closely, and if it works, we'll roll it out as soon as we can. Now, this is just one of a number of innovative testing technologies that we're pushing forward as fast as the science allows. I will leave no stone unturned, and I want to thank everybody involved for their dedication. The second development I wanted to share today is around antibody tests. These tell you if you have had the virus and have developed antibodies in response that might help you to fight the virus in future. COVID-19 is a new virus, and we're learning more about it every single day. I want to be frank with you about what we don't know as well as what we do know. We're not yet in a position to say that those who test positive in these antibody tests are immune from coronavirus. But as our understanding of the disease improves, the insight these antibody tests provide will be crucial. They can help us to understand how our bodies react to coronavirus and how it's spread across the country. We're backing efforts to develop our own homegrown antibody tests through our UK Rapid Test Consortium, and that work is showing some early promise. And as you know, we've been looking at a whole series of commercial antibody tests. Now, many of these early tests were not reliable enough for clinical use, but we have made some available at small scale. And we now have the results of our antibody surveillance study. This has told us that around 17% of people in London and around 5% or higher in the rest of the country have tested positive for coronavirus antibodies. This was based on a sample, but for the public at large to know whether or not they've had coronavirus, we need antibody tests at larger scale. 2 lab-based products produced by Roche Diagnostics and Abbott Labs have been given a positive evaluation by PHE and approved by the MHRA. And 3 further tests are being assessed right now. And I can announce today that we have signed contracts to supply in the coming months over 10 million tests from Roche and Abbott. From next week, we'll begin rolling these out in a phased way. At first, to health and care staff, patients, and residents. The UK government has arranged supplies of these tests on behalf of the devolved administrations, and each devolved nation is deciding how to use its test allocation and how testing will be prioritised and managed locally. This is an important milestone, and it represents further progress in our national testing programme. It's not just about the clinical advances that these tests can bring, although obviously that's important. It's that knowing that you have these antibodies will help us to understand more in the future if you are at lower risk of catching coronavirus, of dying from coronavirus, and of transmitting coronavirus. We're developing this critical science to know the impact of a positive antibody test and to develop the systems of certification to ensure people who have positive antibodies can be given assurance about what they can safely do. History has shown that understanding an enemy is fundamental to defeating it. And in this latest fight, our ingenuity and our brilliant scientists and our scientific curiosity are what will keep us one step ahead of this virus. We all have something to bring, though, in this fight against our common foe. One action that each and every one of us can take is to follow the rules on hygiene, on social distancing, not just for you, but for your loved ones and for your community. So please, stay alert, control the virus, and save lives. I'm now going to pass to Chris Whitty to take us through the daily charts.
Thank you very much, Secretary of State. This is the first slide to show you is a new slide with new data that came out today from the Office for National Statistics, ONS, and other partners. And they've been doing a random swabbing system around the country to estimate how many people have got infection. And over time, this will also allow us to work out how many people are newly getting infections. Now, these are central estimates, and I want to be clear that there are wide confidence intervals around them. But based on these data, they estimate that about 137,000 people in England have COVID at this point in time. This point in time being between the 4th of May and the 17th of May, so slightly old data, and that this is around about 0.25% of the general population. And they also estimate, again, with quite wide confidence intervals, that every week at that stage, around 60,000 people were newly being infected with the virus, so around about 10,000 a day. As the R is still below 1, we expect these numbers to go down and to continue to go down. Next slide, please. Starting off with what all of us are doing, there is clear evidence, firstly, that almost everybody is sticking to the social distancing guidelines and staying at home and traveling much less than they normally would. But there is some increase in activity in terms of people driving and heavy goods vehicles and light goods vehicles, which are compatible with people making a very cautious return to work where that is considered to be safe. But as you can see on the lower graph here, line of the graphs, that the national rail, Transport for London and buses really have remained where we were, very few people using them except for absolutely essential purposes. Next slide, please. The Secretary of State has already talked about testing. Here's a graph showing on the top top of the row of this, the testing rates. This is a combination of tests done and sent out. And then below that, the number of confirmed cases. Remember, of course, that the number of tests has gone up, so the denominator is changing over time, but they are very gradually drifting down. Next slide, please. But important data, I think, here from hospitals. Now, the key thing here is not the absolute numbers, but the fact is the trend lines, which are measured the same way over time. And what you can see is overall, you can see the estimated new daily admissions with COVID-19 peaked in early April and has been steadily decreasing ever since.
Of what is happening around the world, I think it's critical for us to first of all understand how other countries are dealing with the coronavirus, and of course, the most important is we are pretty much following suit. It's a very clear pattern. Let me just try to adjust this light a little bit because it seems a little extra bright today. But it's a very clear pattern of how, the 5 stages, everybody has their 5 stages, no matter what country you're in. So whether it's the UK, the US, the Cayman Islands is following the exact same model. And that's why we had UK Health England or whatever they're called come down here, because of course they're providing us with guidance on how to handle this situation. So good morning to all of you. Hopefully you can hear me well. As you guys know, I'm not using my usual microphone. I do have a backup here, which is going to become the usual one in a minute, because it's not going to be that easy to get certain equipment ordered and certainly on island. So, we use what we can. So good morning to all of you. Thank you guys so much for tuning in today. I do want to talk about a couple of things with the antibodies test, because I think that that's the next direction and the next thing, based on what Dr. Lee has said, that we are actually going to be picking up on. So I do believe it's really important that we understand, why are we even going down this particular route, and what are the benefits of the antibodies test. So we're going to have a little bit of discussion on that this morning. I'm just having a quick look at what else we got going on here. So we're going to talk about a reemergence of this virus actually in China and other places in the world. It does seem like it is prepared to do some sort of migration, how it works, how it operates, my apologies. And so we are definitely keeping a very keen eye on it from that perspective. I think that that's like super, super, super scary. So we will be having a look at that as well. And I'm just having a quick look at a few things here. Okay, yeah. So those are some of the things that we're going to discuss this morning. And there's a couple other things that are going on in our local community that obviously warrant discussion as well. So just give me one quick second here. And I'm going to get all of that done. Okay. All right, so good morning to all of you. Thank you so much for tuning in. It is Friday. Hard to believe at times, but The entire week has gone by rather quickly. We are so entirely grateful for everything I think that we have in our lives, because at the end of the day, regardless of what we're going through, I think we have to be conscious of the fact that, you know, it could be so much worse. You know, we have 10 new cases yesterday, so that was a bit of information that was made available to us. That's a little concerning. I mean, every single new case that increases our numbers, I think, is concerning. However, of the 10, we know that there's one at Foster's Airport. There's one at Al Kebab restaurant store. They didn't say what location. And there was also 4 at Kirk Home Center. So some interesting locations. We'll talk about those here in a minute, sorry. Good morning to all of you. We've got Jessica, Elizabeth, Sherry, big shout out to all of these folks. Elizabeth says, buenos dias. Another Elizabeth. We've got more than one Elizabeth watching this morning. Morna, of course, is here. Louise, all the way from the US, Detroit, if I recall. Yadeli, buenos dias. Evelyn says, good morning. I keep looking on is CMR on my phone to see if I'm watching CMR. I keep looking on is my phone. I think she meant to say I'm keep looking at my phone to see if I'm watching CMR. Good morning, Michelle. Evelyn says we are loud and clear. Dimitri, good morning. Shout out to Olivia. Sue is always here for it. Thank you so much, Sue. And Tamara, you guys are so incredibly loyal. Let me just tell you, I really, really do appreciate it. So we're going to talk a little bit about what's happening around the world. That's why I wanted to show you guys what the UK is doing and what they're looking at. So of course, they are looking at this antibodies test. And we're going to talk a little bit about the different types of tests that are available and, you know, why now our country is looking at this antibodies test. Let's see. Okay, so in terms of worldwide numbers, of course, the numbers continue to rise. We now have over, let me give you the world figures here. And again, keep in mind that there are people, and this is where the antibodies test, I think, is going to become really, really interesting, is there people who are like, listen, these numbers are on the conservative side. So multiply that anywhere from 5 to 10. That's where once we start doing the antibodies test, we will get a clearer understanding of exactly, you know, what is going on with this virus. So I'm glad when governments say that there is a lot, sorry, that we do not know, because that is the truth. And, you know, this virus has done very unusual things. And so at the end of the day, we just have to continue to keep an eye on how this is going to play out. We have over 5.1 million cases now confirmed, over 333 global deaths. Of course, the US has been a particular hotspot, but so has parts of Europe, such as the UK. So the US has, of the 5.1, they have 1.5, almost on the upper side of 1.6 million infected persons. And the US also has over 94,000 deaths. So probably by next week, I expect the US to reach that 100,000 mark in terms of deaths, which is really quite astonishing, to be honest. So, sorry. So at this particular point in time, you know, they are trying to continue to test as much as possible. The truth of the matter is, countries like the UK, they had set targets for themselves on how much tests they wanted to be conducting, like on a daily basis. Because again, the only way to get ahead of this, as you guys saw in that video, they were talking about, you know, the need to try to understand more about this virus. And the only way we understand more about it, its patterns of behavior, what it's doing to people, the whole 9 yards, is if we test. The South Koreans, sorry, had this, I think, really early on. They had a good feel of this, and they were certainly doing a lot of testing, because testing and knowing exactly how this virus is operating, what it does, allows you to try to plan ahead, if you will, plan a course of action to try to mitigate, your losses and everything else that's going on. Unfortunately, when you don't plan and you don't know what hotspots the virus are at, how it's entering your country, all of these bits and pieces of information, which are incredibly critical, you end up making policy decisions that are not as sound as they could be. For example, one of the things that has now emerged is that had there been, in the US in particular, a lockdown, right, earlier in the process, they could have at least saved 36,000 lives. Now, I want you to think about that for a moment, because that is a significant number. 36,000 lives is absolutely nothing to sneeze at. That's a lot of people. And I hear people, this is why I get a little bit agitated when I hear people, talking about the fact that why are we shutting down our borders? What's the point of that? Keep the borders open. This will somehow benefit us. And I think to myself, sorry, they just are not getting it. Yes, everybody at some point has shut down their borders. Some people will reopen their borders earlier than others. But the interesting thing to note about reopening your borders too early, or the fact that you delayed shutting your borders, is that it had a direct impact on your numbers. And so this information now that is coming out of the US is a perfect example of that. So we know for a fact that, if the US had closed their borders even just a little bit earlier than they did, they could have saved 36,000 people from dying. So they began social distancing, and not just closing their borders, because keep in mind now we're talking about their external borders to certain countries, right? This particular study has found, and this is based on some new information that came out yesterday, this isn't even so much about closing the borders. This is basically saying that had the US started to impose social distancing measures even 1 week earlier than they did in March. So by 1 week, 1 week seems so insignificant in our lives sometimes, right? Even here in Cayman, we always talk about patient number 1, who was the Italian guy. I was having this discussion with someone yesterday, and I want people to be very clear about what I've always said. The only reason that I've ever had any concerns, honestly, about patient number 1 is the fact that he was taken to a facility that didn't realize the risk of, what they had in their hands. So as a result of that, they treated him like any other patient, and treating him like any other patient allowed it to spread within their own facility, and they had to end up shutting down their own facility. Outside of that, I honestly believe that we already had coronavirus here. It's almost impossible for us not to have had it here. We were letting people in on cruises. We were letting people in on the airplanes. People were coming back and forth from all sorts of countries that at that point were definitely contagious. And given what we now know about the cruise lines in particular, I would believe, there's no way to ever prove this, that was probably our first port of entry. And we see again, we have to look at things not in isolation, because Cayman does not operate in a vacuum, right? We interact with other people in the world, and we see data, for example, coming out of Miami-Dade County, showing that there are people there who turn up having COVID-19, And when they look at the period of time, which is the incubation period, those 14 days that they would have been walking around very much asymptomatic, but still contagious and still spreading this virus, they talk about, where they were, what they were doing, and come to find out, lo and behold, they were actually right here in the Cayman Islands, enjoying a cruise and enjoying a vacation. So I don't believe that patient, the Italian guy, was our first patient. I've never believed that. And that's not why I have really kind of gone hard with that situation. It's more a question of, had the physicians and the respective medical staff who were dealing with him treated him as though he was infectious, which in my opinion to this day, they should have had a well-educated, reason to believe that he was, and treat him accordingly, keep him in quarantine, et cetera, et cetera. We may not have been able to save his life because of his underlying issues, unfortunately. However, we may have been able to prevent an entire facility from being shut down, as well as having additional infections that we have now added to our slew of numbers. So we've had 10 more persons tested positive. Like I said, these numbers will continue to rise. No doubt community spread. I don't know how much contact tracing they're still doing. Sorry, got a little nose itch here. I don't know how much contact tracing they are still carrying out at this particular stage, but I guess they still want to get an idea for record keeping purposes of how this virus was acquired. But, we've got local spread. So at this point, it's like you're getting it from people that you're interacting with on a local level. We don't really have a whole lot of people coming in anymore. Those persons who are coming in are going directly into quarantine. They are being made to stay in quarantine. They're being tested, so again, lockdown and social distancing becomes an important part of the containment of this. And this is why, yes, I call people jackasses when they don't even understand the importance of lockdown. You guys remember the whole situation with the salon girls over a week ago, right? They were going getting their hair done. I actually had a parent contact me and she's like, what's the big deal? I have people coming to my house. If my family members who are not in my household come over and they want to sleep over, whatever, I'm allowing them to do that. And I'm just like, oh my God, are you kidding me? Yeah, and everybody's getting their hair done. I'm like, really? Look at my hair and tell me that everybody's getting their hair done. I look like a friggin', I don't even know what right now. A chihuahua or something with mad crazy edges and hair and whatever, right? And so no, not everybody, thank God, is completely ignoring these provisions. Not everyone is ignoring social distancing. A lot of us are respecting what's in place and we're trying to follow the law as much as possible. So I don't get it and I don't understand when you say to me, it's not a big deal. And everyone is out there doing this, including your family member who is just, included in this group of persons. At least this person didn't want to lie and say this was an old photo. So, that's why I get annoyed. And that's why I think if naming and shaming people is one way in which to get people's behavior to change, then I'm all for it. I'm sorry, but whatever it takes, I don't really care. So 36,000 fewer people could have died from the coronavirus outbreak, according to new estimates from Columbia University disease models, had the US began lockdown and locking down cities and limiting social contact on March the 1st, which is 2 weeks earlier than most people started staying home. And the vast majority of the nation's deaths, about 83%, happened during that time. And they said that could have largely been avoided. So under that scenario, about 54,000 people would have died by early May. And the enormous cost to take action reflects the unforgiving dynamics of the outbreak that swept across American cities in early March. So they're saying that this difference in timing could have prevented, or at least flattened the curve a bit or delayed the curve of what they're calling this exponential growth. So it was just like, whee, and it kept going straight up. Cities like New York, New Orleans, and those are some of the biggest cities. And so, you know, these people, Columbia University, they engage in looking at statistics, looking at graphs, and talk about modeling, engaging how certain things like contact between people, which started in mid-March instead of early March, could have slowed the transmission of the virus. So I thought that that was really interesting. And again, you know, I believe the same thing here in the Cayman Islands. Had we started earlier than we did, we would have certainly had less numbers. Our borders would have been shut sooner than that. And I think that that could have gone a real long way in preventing. Thankfully, we've had no further deaths, but nonetheless, it could have gone a long way in preventing the number of infections that we now have. And again, statistically speaking, you know, our infections remain largely asymptomatic. So in other words, they're walking around looking perfectly fine, and you just do not know that they have it. Now, yesterday I had to go out on the road. I think I told you guys that in the morning I had an appointment at, well, I was a little bit late for my appointment. It was supposed to be 8:30, but I had an appointment in the morning. And so I had to drive through town to get to my appointment. And one of the interesting things I observed is a lot of people were wearing their mask, which is good. And I want to play a video here this morning about this lady who kind of went off on someone who's wearing a mask. I think you guys are going to find this interesting for a number of different reasons. And of course, she has a point. You know, it's kind of interesting that even in a crazy moment, we can be right and we can have a point. And this lady, I think, is no exception to that. So I'm gonna pull up this video. I can't remember who sent it to me, to be honest, but I am going to share this with you guys because I do think that this woman, despite the manner in which she delivers the message, she does have a valid point about the wearing of masks. And you guys know that I think it was on Wednesday, on this show, we actually addressed how important it is to be careful when you're wearing your mask. So I observed people, for example, wearing their mask when they were out in the open air. There's no one anywhere close to them, and they still had their faces covered up. So we now know that that can actually be extremely dangerous because you're breathing in your CO, which is your recycled air, basically. And so that's not a good thing for your health. And you know, she was kind of, I'm going to show you this thing. This one was refusing to wear a mask. This is in the US, of course, claiming that her constitutional rights are being violated. However, you know, she makes some points about the dangers of wearing a mask. So Morna says, Sandy, my opinion on this whole situation, we need to lock down the whole island and test everyone that's on the island because there are nothing going on coming into the country, and more, we're still a very small country. So what are they waiting on? Waiting for death to take its course? That's my opinion. BOBO. What does BOBO stand for? I don't know what BOBO stands for. Morna, help me out here. Good morning, Matthew. Thank you so much for the compliment. Tanisha, good morning. Tamara says, I agree with you, Sandy. It was there before. In regards to the U.S. closing borders early, could have saved lives. I don't believe it. Starting social distancing early, yes, could mitigate the spread. Yeah, Tamara, let me clarify. That article was actually specific, not to the closing of borders, but to the shutting down of cities, which would have forced people to engage in social distancing. So for them, it wasn't specific to closing the borders. So let me just make that clear. Matt Lee, good morning. Thank you for tuning in. Sue says the UK has gone crazy this week. Packed beaches. Unbelievable. Parks, way too many people just don't care and they act like no COVID there. Oh my God, unbelievable. And this is the fear with us starting to reopen the borders, is that people may try to do this exact same thing. And I think that the Premier is very, very cognizant of that. He is very much aware that, you know, people may take this very lackadaisical attitude. because borders are starting to reopen. And we see that happening around the world, including China. And so we're going to talk about here in just a minute what is actually happening in China, because they have a reemergence of this virus as well. And that's not good. So let me pull up this video, because like I said, the lady's a little crazy, so it is interesting from that perspective. But despite that, she makes some very valid points. Now, I want you guys to be cognizant of the fact that these 10 new numbers that we have, a large majority of them are indeed frontline workers. So a very large number of the 10, because that's who they're now testing: construction workers, frontline workers, etc. Now, the interesting thing about the frontline workers number, and I thought that this was super interesting. Yesterday, when we started to hear Al Kebab, we started to hear Foster's has another one, which, by the way, stick a pin. I want to say in terms of Foster's, I am very surprised and pleased at the low number of infections that Foster's have, given how many people they were actually testing. You know, I think that it's fair to say that when you have 740 employees, I was actually expecting at least a minimum of 5 positives. We see grocery store with far fewer people than that who actually had way more infected persons when you think of it statistically speaking, right? So I must take off my hat to the management team at Foster's. I think they have done a wonderful job putting measures in place early on that clearly have benefited their staff and by extension, their customers as well. Because when you go into a business, the fewer frontline staff that have it, you know, the more likely they are to pass it on to other people, including customers or patrons to that business. So kudos to Foster's for putting their early measures in place, which I think, sorry, by and large, have been extremely effective. Yeah. So other people, and this goes now to the point that somebody was just making. Let me just look at your comments again. That was about testing. Morna, about testing everyone. Morna has a very valid point, because at the end of the day, I think that testing heavily, again, has been the key to a number of different things. So here we are slowly reopening our borders, which people are getting a little bit stir crazy. We understand, you know, some of the logistics of retesting, of testing and keeping everything closed. However, if we're now going to say, and remember, this is where planning becomes critical, right? So we have this 5-step reintegration plan, whatever the heck they're calling it. That's not the exact name. Let me pull it up here. The suppression levels, 1 through 5. Well, really, it should be 5 through 1, because we were at maximum suppression. Now we're at moderate suppression at level 3. We have known that this is the plan, because if you started watching at the beginning of the show, everyone around the world is pretty much using that 5 level suppression plan. And some people are providing, we haven't provided a whole lot of details in this diagram, but some people are providing very specific details about what each level of suppression looks like. So we're not doing anything novel in this regard. We are simply copying and pasting what other countries are doing. And I'm not taking anything away from the government or the civil servants. I'm just giving you guys a reality check of exactly how this works. So the UK has the exact same plan. I've seen the same plan in Bermuda. I've seen the same plan, pretty much all over the world. So nothing new there. So we knew when we get to level 3, these are the types of businesses that we're going to be seeking to reopen, et cetera, et cetera. Fine. Then tell me, why we didn't know in advance, at least a week ago, that businesses like the hardware stores would be opening on Tuesday. Of course we knew. Knowing that bit of information, why didn't we seek to have all of their staff already tested? Is it too much to ask? Like, am I asking too much here? Are my expectations too high? So now we know Kirk Home Center has 3 people. The grocery stores I can get up to a point, because you can't just shut down all the grocery stores and not have that impact the numbers who are then swamping to another grocery store and potentially, creating long lines, more social distancing, running on groceries, all that kind of stuff. So the grocery store is a little bit different. But since March the 21st, our other businesses have been closed. So if you're saying hardware stores are going to reopen, we only have how many hardware stores on the island? The major ones, A.L. Thompson's, Kirk Home Center. What else is there? Help me out here, folks. Anybody else? There's like smaller ones, but those 2 are the biggest hardware stores, right? A.L. Thompson's is obviously bigger. Uncle Bill's. So you take those hardware stores and you test everyone before you allow them to reopen. That way, thank you, Jonathan. I just remembered Uncle Bill's. My apologies. That way, before they even reopen their doors, they've already identified people who are positive, Larry's, thank you, Olivia, and you do not let them back into your business when you reopen. Oh yes, Haley Cox, thank you. So we have Cox, Larry's, Uncle Bill's, Kirk Home Center, A.L. Thompson's. 5 maybe? That's not a whole lot, right? So, okay, they're going to be coming up on Tuesday. We're back into next week. So we've just gotten in our time capsule. We've traveled back. How many people do you think that represents in terms of employees? I don't know. Maybe 600 people, if that. Because I don't see A.L. Thompson's probably have more than a couple hundred staff. So you do mandatory testing. That should take you 2 or 3 days to just test all of those persons before you allow them to reopen. And that should have been, Michael mentions ACE, thank you. Again, really small. ACE probably has 5 to 10 employees. They don't have a whole lot of people. So you do mandatory testing of those businesses before you allow them to reopen their doors. How does that help in the real world? Kirk Home Center now has 4 employees that they've confirmed have it. Those 4 employees never get to go back to work. They never get to contaminate any work surfaces because clearly they didn't catch it at work. If they just opened on Tuesday, and here we are yesterday, which was Thursday, so within 2 days, we know that they now are testing positive. They did not catch that at work, okay? 14 days. So they had it, community spread, people connected, travel history, whatever. But you do not allow them back into the work environment without being tested. And so, Morna, I agree. Test everyone and do strategic testing based on what you know your suppression levels are and what your plan of action is in terms of opening and trying to reopen the various business community. So in another week and a half, we're going to have another, hopefully if the numbers continue to trend downwards, we're going to be opening up additional businesses. Right now, the plan should be, whatever those businesses are, the Department of Commerce and Investment, DCI, issues business licensing. They know who they are, do a public announcement. Listen, for the next phase, it could be beauty salons. Sorry, my sinuses again. So if it's beauty salons, right? Every single employee in a beauty salon, come in, start to get your testing done. So we can start identifying if there are any beauty salons that have employees who've had it. And trust me, if they're like this young lady who's doing braids and wigs and whatever, chances are she may have come in contact with someone through community spread who actually has this virus. And I want to talk about the importance of the antibody test. So I see some of your comments coming in relation to testing. So give me one quick second. I'm sorry, my sinuses are just going haywire again. So I'm going to just show you you know what, we didn't get to, let me see what I can pull up here while I take a break with my sinuses. I actually want to show you guys a picture. This is not the nicest picture in the world. However, this is a guy in the US who actually had coronavirus. Now, he is, I'll tell you a bit of information about this. I want you to reflect on this picture while I blow my nose. I'm going to mute my mic. But I want you to I want you to have a look at this photo, because this guy has lost 50 pounds after getting COVID-19. So this is shocking. Just give me one quick second here, and then I'm going to tell you a little bit more about him and who he is. All right, folks. So I've got my left sinuses that are more clogged than the right ones right now. I feel like I need a bottle of Vicks in my hand at the moment. That'll help clear it very quickly. Okay, so we have this guy. His name is Mike Schultz, and he's actually a nurse. And they say that he is a walk-in billboard for how COVID-19 can ravage your body, assuming that you survive. Now, he has become almost unrecognizable after a 6-week battle with this virus. Mike, who's 43 years old, he's a nurse from San Francisco. He got coronavirus-induced pneumonia. And in that amount of time, he actually lost 50 pounds. So he said that he used to work out 6 to 7 days a week. He was hospitalized on March 16th, a week after attending an event in Miami. And this was before they had locked Miami down. So again, we see when we talk about the importance of early intervention and of locking people down. He was attending an event in Miami, and that's where he suspects that he picked it up. And nearly 40 people from that event actually contracted the virus, and 3 have died. So he's very unfortunate. And then within days of arriving in Boston, his fever hit 103. He struggled to breathe, and his lungs were filling with liquid. So they raced him to the hospital. And sure enough, he was so weak at one point that he could not hold up his own cell phones, and his hands were shaking when he was typing. So those of you who think it's no big deal about the coronavirus because we don't have any deaths, you need to understand that death is not the only devastation that this virus causes. So have a look at this. I'm going to put my mic in mute again one more second. So yes, this poor guy, he was close to death, I would say. Now he's back on the road to recovery, And, you know, this is a man who was the picture of health, working out almost daily before contacting coronavirus and COVID-19 disease. And now look at the poor guy. I mean, look at him. What an amazing transformation. 50 pounds. I mean, he looks like he is terminally ill, which is, I mean, just shocking, right? So again, let us not underplay the impact that this disease can have on so many people around the world. I think we have been so fortunate. And because we've been so fortunate, I do believe that there are people here in the Cayman Islands who are taking that good fortune and being misguided by that and thinking that, you know, this is a conspiracy theory and coronavirus is no big deal. It's pictures like that. I was trying to get a friend of my husband's on the program. He lives in, I think, New York, and he has had the coronavirus as well. And he's now in recovery mode. And I mean, he has some really interesting things to say about that virus. Although, you know, supposedly now he's over it, he has said that the long-term impact of what it does to your body is just unbelievable. And I'm still hoping to still get him on the program to share his experiences with us and to talk about this, but it is just unbelievable, really and truly. I mean, he said that there's still times now when he struggles for moments in time to breathe and stuff like that. There was something in the news recently as well about one of the, and it wasn't so recent, it was about a month ago, and I kind of missed it, but I've been seeing it more and more lately in the news, about one of the additional possible symptoms of the coronavirus is that you lose your sense of smell and, is it smell and hearing or smell and taste? Hold on one second. I'm going to tell you. And I saw someone on Facebook saying, oh, yes, they're making up all these symptoms of coronavirus. Is this because they want to push this agenda about the second wave? And I'm just like, what is wrong with people? Like, I do not get why people want to buy into, oh, this is all made up. The second wave is a joke. That's not really going to happen. You know, don't listen to the authorities. I'm like, what do you gain exactly from buying in to these conspiracy theories? And what does it take for you to realize that this isn't a joke? Historically, we know from the Spanish flu and other such things that a second wave is part of what happens with these pandemics because people tend to let their guards down. So why are you going on about, oh, a second wave is fake news? Why? It's happened before. So what makes you think that it's not going to happen again? Especially with people like yourselves, some of you, who conspiracy theories walking around, who don't believe anything and don't care. Do you not believe that the US has not almost 100,000, in reality, well over 100,000, but they can only say for certain that they've got 94,729, but we know that they have more than that are dead. You know, if your family members to these people who've lost multiple people in their family, how do you reconcile your thought process? Like when you sit down and you type these posts on Facebook and talk about, oh yeah, well, you know, now they're talking about a new symptom of COVID-19, which by the way, like I said, actually isn't new because it was in the media for over a month ago. So just because you're not catching up on it, because your sick Buttar guy, who's a conspiracy theorist, only has now said it. So you're thinking, oh, this is factual what he said. Do your research, folks. This lack of smell, and I think it's I'm just trying to double check if it's taste and smell, or but it's connected to the nasal, the air, nose, and mouth connection. You know, so people don't get, first of all, that yes, there are things that we do not know. They've said it from day one. This is a new version of the coronavirus, COVID-19, SARS-CoV-2. We don't know everything about it. I think it's lots of taste and smell. But, you know, we don't know everything about it. So right now, what's trending in the news is that they're saying as of 23 hours ago, a new symptom that doctors have started looking at is potentially neck pain. So that's what they're going to jump on next. Like, oh my God, now they're talking about neck pain. Oh, now this is second wave conspiracy. It's just like, people, if a physician tells you, or the scientists tell you, we don't know everything about this, right? We're learning. So as we see more patients and as we take down statistical information, we take down information about their symptoms, we take down data, there are patterns that will emerge. And this is why early on, they missed completely that they had the coronavirus in the United States of America, because I'm trying to find that article that I read. When they had early warning signs of the coronavirus in the US, they did not pick up that that's what it was. However, I listened to a very interesting podcast that was saying that, one of the things that they missed early on, but the physicians in the emergency room, they knew something was going on, because they were like, all of a sudden, we started getting a really high number of people coming into the emergency room who were having this respiratory type of illness. Normally, you'd have someone coming into the ER with respiratory condition once or twice a week. All of a sudden, it was like 4 and 5 a day. So the emergency room physicians themselves were like, what's going on here? Something is emerging. Something's going on here. But it took weeks later for them to start saying, oh my God, we actually have coronavirus cases. That's why the numbers will never be accurate. Because initially, they were treating just the respiratory condition and not realizing this was being caused by COVID-19. This was now full-blown COVID-19. And one of the interesting things, and the one that I read and identified, was how they were saying that it was so amazing. I'm going to try to find that video to share it with you guys. I think it's important, again, that we educate ourselves about the history of this, how it's operated, and how it works. So they said that one of the interesting things was people were coming in with the respiratory distress and illness and disease, and they would deteriorate so quickly. It was like they would come in within a matter of a couple hours, they had to put them on a ventilator or they were going to die. And they had not seen anything like that. There are people who had been emergency room physicians for a really long time who had not seen, oh God, my sinuses are killing me, who had not actually seen anything like that at all. Ellen says, curious about everyone that wants us all locked down so we have 0 cases. How do we then open the island back up? Or do we still stay closed for another year? Thoughts? Ellen, let's have a discussion that. Give me one quick second, folks. I have got to go and I think I'm going to get me some Vicks this morning because I'm really feeling super congested. So just give me one quick second. We'll do a quick song and I will be right back.
Oh, land of soft, fresh breezes, of verdant trees so fair, with
All right, folks. Thank you for hanging in there with me. I had to go get my bottle of Vicks and my rubbing alcohol. I'm going to do some stuff that the old people, always tell you about. Um, it's just sinuses, but I don't want to take a Benadryl or anything today because I've got so much work to do. I can't deal with the side effects of the Benadryl. So Miss Maureen was telling me the other day, she's making some recommendations of what she used to do. Not Maureen, sorry, I just want to tell you her. Marion, of what she used to do with her sinuses. And for me, it only is in the morning. So normally by 10 o'clock, it's all clear and I'm fine for the rest of the day. So what I try to do is I try to just wait it out. But she did recommend, which the doctor did say as well would help, is just maybe irrigating my sinuses. But I have a real problem with irrigation. So instead, I suffer through it every morning when it kind of flares up. So Alan says, what's the point of a complete lockdown? I think when people make that comment, what they're suggesting we do is we lock down completely, test everyone first, and then reopen based on what the test results show. But this goes back to us not knowing everything about this virus. And I think even that suggestion in that model does come with less risk, but there are some risk involved in that because you assume that once someone has it, or once someone has tested positive for it, that number one, they can't get it again, which is an assumption that is likely incorrect. And the other assumption is, let's remember now that the testing that we have available, which is the nasal swab that they do, which is not very nice, but that's what they have. That particular test does not allow you to know if someone has ever had the virus before. So all that is going to do is tell you in this present time, do they have it? And so they could be, say, of their 14-day incubation period, Morna, they could be at day 5, 6, or 7 and not yet shedding enough of the viral material for that test to pick up on if they even have it. So you would still be operating under a misguided assumption that if you tested the entire population with the available tests that we're now using, that would allow you to reopen freely and not have any concerns. And that's not the truth. That is why, even after we've tested, even after we know who's had it, who hasn't had it in real time, we still need to do the other things that are important. The social distancing, keeping your kids locked away because children are extremely vulnerable for a number of different reasons. Number one, they tend to be the biggest carriers of the disease because, again, early on, the statistical information available demonstrated the fact that they are by and large, which the community by and large is asymptomatic, but definitely children were initially not showing a lot of symptoms at all. And this could be one of the reasons why they were thinking in the early stages that this disease was actually sparing children. It may have been a situation where it wasn't sparing them at all, but so many more of them were asymptomatic, or you just thought it was the regular cold that kids pick up every other day because that's what children do, right? So parents weren't taking it seriously. They weren't having the kids tested for COVID-19, but in fact, children were acquiring it and then passing it on in daycare centers and other places to, other children, and it would spread very, very quickly. And then what those children do is they go inside of their homes and they pass it on to the adults and grandparents, etc., who are so much more vulnerable to getting it full blown. So that's the one thing, Alan, and anybody else who is suggesting that mass testing and then opening up everything is the answer. Not quite. Mass testing, yes. However, we have to continue to be guided by the fact that we do mass testing and we still are cautious. We still engage in social distancing. We still have to shut down certain hotspots like schools and so on. As you guys heard in the video at the beginning of the show, even in the UK, they have to keep in their minds that yes, we are going to, you know, try to, as much as possible, push for a vaccine. But we also have to tell people realistically, and this, I know the anti-vaxxers are not going to like this, but there's a possibility there may be no vaccine. Certainly not in the immediate future, and they may never find one. So, you know, hold your horses with your conspiracy theories when it comes to vaccine, because if they don't find one, we have to look at other ways of managing the coronavirus 2019 outbreak. So keep that in the back of your head. A vaccine is not a guarantee. Herd immunity is not a guarantee. We don't know any of that stuff as yet. They're doing some early clinical trials on some possible vaccines, but again, they don't know how effective they're going to be. Because what a vaccine is going to try to do is it's going to try to emulate this process of herd immunity, if it's possible. And we don't know that information yet. And that's where I really want to caution people about the things that they say and the assumptions that they make. So they noticed some time ago that loss of smell and taste is actually one of the symptoms of coronavirus. So the UK has officially added that to their list of symptoms that people should look out for when they're deciding in their case to self-isolate. So up until that point, they were saying a cough and fever were the triggers for people to self-isolate and the things that they should be looking for. But now ENT, so that's ear, nose, and throat doctors, have been warning people for weeks, and this information is about a month old, to be honest, that additional symptoms related to taste and smell, or the lack thereof, so losing your sense of taste and smell, is another one of the clues that you probably have the coronavirus. So again, if someone has a continuous cough, fever, or loss of smell or taste, also called anosmia, you learn something new every day, folks. The advice is for them to stay at home for at least 7 days to stop the risk of giving coronavirus to others. And it says here that the cough and loss of smell or taste can persist for up to 7 days. So again, that's something to look for. Signs of other respiratory infections, mimicking like the common cold at the very early stages. All right. So fever, tiredness, continuous cough, loss of smell, breathing difficulties, obviously by the time you get to that, aches and pains, sore throat, even diarrhea is one of the symptoms of this as well. Conjunctivitis, which is red eye, headache, a rash on the skin or discoloration of the fingers and toes, which, as we know, is now being referred to as COVID toes. And in particular, children seem to be exhibiting that particular symptom, as well as this Kawasaki disease. So in the UK, again, the overall death toll is the highest in Europe at over 35,000 persons dead. So add that to your list of things to look for, but it's nothing new. And so those of you who are on social media talking about, oh yes, now they're claiming this is new. Look for this. They're claiming that the reason why the physicians are warning people about these symptoms is they're trying to justify the second wave. They don't have to justify the second wave. Just hold on tight, folks. It's coming, largely in part because people do not want to believe this. So they're willing to go out there and take the risk of associating with other people, infecting themselves, because they don't believe. And it's amazing that people who work in management in local businesses that are frontline employees who have had their own staff tested positive are some of the same ones who are out there perpetrating this message in our community. And when I look at their social media posts, I'm like, do they have no sense of responsibility? You're not just, people trust you, not just in your personal capacity, because in your personal capacity, you have no reason why we should trust you. You're not a physician, you're not an expert on this, but you are a manager at a business with frontline employees, i.e. a grocery store. And you're putting up all this propaganda foolishness on your website when you have employees that might be looking to you for guidance. Even on your social media page, you have other people in the community who could be visiting the grocery store that you're a manager at and that you work at. And here you are being very irresponsible, talking about, oh, a second wave is just a conspiracy theory. These symptoms are all made up. Don't listen to what the doctors and the professionals are saying. And it is very, very concerning, I think, when certain people engage in this type of dialogue. So Roger says, we cannot go back in time to correct anything. However, we have gained knowledge from it. I support the lockdown 100%, as some people are still gathering to party. Also believe they're opening up locally a bit early, and I hope that we don't have the international courts open until 2021. Roger, give me 1 second. I do want to address that. Again, I do have to blow my nose again, so sorry about this, folks. Just give me another minute. All right, folks, I'm back. I'm like, just blowing my nose. It's like the congestion is on one side of my nasal cavity and the left side this morning. So I got my rubbing alcohol here. I'm disinfecting my hands. And of course, when I blow my nose, the tissue goes right into the garbage. So I've got a whole roll of tissue here that I'm using this morning. Oh. All right, folks. So yes, Roger makes a good point, and I want to talk about something in relation to what Roger just said. We know that on Tuesday, was it, or Monday, CMR broke the story, I think it was Monday, late on Monday, about certain people at the prisoners being infected with COVID-19, having tested positive. And the question then becomes, we know at least that one of these people, and I suspect both, but we do know the identity of one of these people has been locked up for quite some time. So this isn't a situation where they just got into jail. And so the question becomes, well, where did they get it from? The most likely source is probably prison staff. And I'm going to tell you why I believe that to be the case. First of all, there are rumors in circulation that I would believe, just wiping down my work area, sorry, that I believe are potentially very, very accurate, that certain members of the prison staff are out there not practicing social distancing, again, because they believe that they are somehow immune, superhuman. I don't know what their logic is, but we have evidence of them engaging in social activities with people outside of their household, which we have passed on to the relevant authorities. Because when you're in a position of power, like a prison officer, a police officer, and you ignore the laws in place that you're actually trying to enforce on other people, but you ignore them professionally, from a professional standards perspective, we have a real concern, and you need to be reprimanded. So we will get to potentially calling you a jackass of the day once our information checks out. But some of these prison officers, it is alleged, have been going to parties and social gatherings that amount to a party, playing dominoes, sitting down, drinking, hanging out with friends, whatever, when they should not be doing so. And so the likely source of infections at the prison are probably not the prisoners at all in terms of how it was introduced, but more often than not, it came from the employees. Now, I have heard some stories about prison officers, prison officers refusing to take the COVID-19 test. I hope this isn't true, because you would be Jackass of the Year if that was correct. And not only would you be Jackass of the Year, but the government can compel you to actually take the test. So you shouldn't even have a choice. You shouldn't even have a say. But if you're purposely avoiding taking a test, then we've got a serious problem, especially now hearing that some prison officers, I'm sure this is a small percentage, are engaging in very high risk activity when they are not at work. And if they catch it, they go into the workplace, they are then potentially exposing staff. And the irony of this is one of the persons who I have a name of, one of the prison officers, who it is alleged was engaging in this behavior, has now mysteriously disappeared as though he might actually be in mandatory quarantine or lockdown. If we find this out to be true, trust me, sir, I will be blasting your name from East End to West Bay, because this is despicable behavior. Couple things I'm checking into, right? Of course, the authorities will never tell us definitively if this particular prison officer has it, but other people talk, and other people are talking. And so we have our suspicions of precisely what is going on at Her Majesty's prison service. So yes, Roger, I agree with you. Testing is mandatory, but again, because of the type of testing that we have available, which will only tell you if you have it at this particular stage in your life, that presents some difficulties. That is why the antibodies test is important if we can get one that is reliable and can give us the results, within, say, 99, 98%. I mean, there's always going to be a margin of error, right? So here's the Mayo Clinic had this to say about testing. Since COVID-19 is a new disease, much is still being learnt about how it spreads and the severity of illness it causes. With all the news around the pandemic, it is understandable that there's a lot of confusion, particularly around who may need testing and how to get tested. Okay, so early on, remember, even here in the Cayman Islands, we had this, and I actually want to pull up something else here. We had the criteria, the three-pronged criteria for why you would want to get tested. So you had to be showing respiratory distress, respiratory illness, in order for you to even be eligible for testing. And that was, I think, one of the mistakes, that we adopted early on that we probably should not have. So we adopted it again because, to be honest, everything that we're doing, we are adopting from somebody else. I'm not saying that trying to take away from anything that the government is doing. That is just a fact. So what that means is there are times when we are adopting policies and procedures that are actually not really the right ones for us to be adopting and are detrimental to our future progress with this disease. Now we know that. So as Roger said, hindsight is 2020. The reason why we need to stay in contact with everything that everyone is doing, why the sharing of information is so important, is because even before the World Health Organization said, okay, we're changing this, you guys need to be testing. Even before that, here in this program, we were saying that because we were actually saying that because we could see patterns of what was happening in South Korea and how they were getting the coronavirus under control because they were doing widespread testing, drive-through testing, the whole 9 yards. Was proving effective. And so I say again, this is where our medical leadership, the chief medical officer, our political leadership, everybody involved in this process needs to make sure that they're keeping on top of the available information from trusted sources. So whether the CDC makes an adjustment to their policy, PAHO, which is the Pan American Health Organization, or the World Health Organization, sometimes it takes them a minute to update their information. And that minute can mean weeks of lost time in the real world. And so as a result of that, of course, we don't pick up on critical changes that we should be enforcing almost right away. And of course, early on, we didn't even have enough test kits. Eventually we got all of that sorted out. So let's talk about testing. Oh my gosh. 1 second. Let me play this video of this lady during this next break. And I want you guys to, we're going to talk about this, not right after we watch the video, but we'll talk about this here in a minute as well. But I want you guys to watch this video.
We're going to get a lot of lawsuits on them.
So it's against the law?
It's against the law to make you wear a mask. It's against the law. The ADA tells them that you cannot make people wear a mask. It's not our laws at all. This is just made up by Bill Gates and them, and by you wearing that. Seriously, think about it. You're breathing out your toxic air and you're breathing in the same air. You're making your lungs, you're killing your antibodies, so that if there's a cold that comes around in November, you're getting sick. You're making yourself sick. You're making, breathe.
Yeah, you're spitting out too.
No, baby, that's not what's going to make you sick. You're alive. Go look on the package, and it will tell you. It will not protect you from COVID-19. You are hurting yourself. Don't stop being lied to. They want to kill all the Mexicans.
Do you believe in the COVID?
They want to kill all the black people. They want to kill everybody. Watch out what you're being told. You're being lied to.
Do you believe in it?
Do I believe what the COVID? I believe there's a virus, but it's not what they say. It's like any other virus. They have 99% cure. 99% cure. So what kind of a virus is that? We all had viruses. We all get colds. You're being lied to. Please do your due diligence. Read, do your research. Don't let the government fool you. Be smart, please, for your sake. Because what's happening is she's hurting her antibodies in her body. She's breathing in the toxicity and the carbon monoxide that is going to make her sick. She's not getting enough breath in her lungs, which is going to cause her lungs to weaken. It's all damaging. Look it up for yourself. Go online and look it up.
I will.
Take my word. Thank you.
Okay. So, they say even a broken clock is right twice a day. The interesting thing about this woman is there is one thing she actually said in that whole rant that is actually true and relevant, but she's mixing information that makes sense with information that doesn't make any sense. And she's blaming Bill Gates for telling people to wear masks, but Bill Gates has nothing to do with the mask wearing thing. It's like they want to blame Bill Gates for everything, apparently. So blame him if we get a virus, a vaccine. Blame him if we don't get a vaccine. Blame him for the recommendation that people wear masks. Bill Gates has nothing to do with that. The one thing that she said that is correct, and the only thing that she actually said that is correct, and then the rest of the rant was kind of mixing of information that actually makes no sense at all, is that the wearing of masks can be potentially dangerous if you are wearing a mask all day long. That is why, in fact, the plastic shields, which does allow for the flow of some air to come in and for you to breathe and it can exit out at a certain point, are healthier for you if you're not in a position to wear like a professional mask that is extracting your CO, which is, that's what when you breathe out CO, and that's like recycled air, and you don't want to be taking air that you've already breathed out back into your body, because that can create what we told you guys about the other day, the hypercapnia, right? And that can be deadly. That can cause you to go into shock and to die in worst case scenarios. So she has a point about that specific thing. Everybody else, everything else about, it's killing antibodies in your body. No, the antibodies, and this is why we need to know about testing and how it works, is what your body produces if you get a virus. So again, she's not even understanding the basic term of antibody. And then if you listen closely to what she says, she also mixes up, oh, this is just like any other virus. This is, like the cold. She doesn't even say like the flu. She's like, this is like the cold. Not quite. Not quite. This is where, again, we have to be careful where we get our information from. So the antibody test, there has been some concerns about that. I told you guys some weeks back, probably almost a month ago, that the UK, spent over $20 million trying to acquire antibody rapid testing kits, because we now know how incredibly important testing is. And so the quicker you can get test results, the better. Well, yes, only if the test results are actually accurate. If you're getting test results quickly that are wrong, that's not going to help you understand what is happening with coronavirus or anything else. So this is where you need to be extremely careful. So again, an antibody test will test whether or not you have potentially ever had the virus. So the PCR, I think is what it's called, testing that we do right now, which is with the nasal swab. They stick it all the way up your nose. There's a reason why that swab is so long. It is long like that because they need to get far enough up your nasal cavity where even if you're asymptomatic, which means that you're not really shedding a whole lot of the actual virus, right, to infect other people necessarily. You could be shedding some, and we've seen pre-symptomatic, we've described what that is and how pre-symptomatic people are still able to spread the virus. So they have to go far enough up your nasal cavity to try to get a good enough sample. That's why they're digging up there. They're not digging up there because they're trying to make this unpleasant for you. They're digging up there because they need to get a good enough sample of whatever you have in your nasal cavity. And of course, the thing that they're looking for in your nasal cavity is this particular COVID-19, right? So they test. That only tells you, again, if you have it in real time, the advantage of an antibody test that is effective. And this is where, a lot of people are saying we're not there yet, is the antibody test would actually tell you over a period of time, has this person ever had it? So you're testing the antibodies, which are the what would we call this, genetic material, the genetic response in your body from having had a virus. So just like when we get, she's right, when we get other viruses, our body develops antibodies. A lot of what she said in that video, 99% of what she said in that video made absolutely no sense at all. However, everybody is working on a more reliable antibody test. It's going to be a blood test. So if you guys have ever dealt with someone who's diabetic, you would know, you would kind of understand this concept a little bit. When you go and you have your sugar taken, right? There is a test, which most of us take, that tests your sugar levels right now. So that's your fasting test. They tell you go in the morning, Don't eat overnight. Go in the morning, have your fasting test done, and that tells you what your blood sugar level is presently. That is a really important test. And most people, that's part of their regular medical checkup because they can give you an indication of where your sugar level's up. If your sugar level has spiked in the morning, despite you haven't had anything to eat, then they're thinking, oh, you're diabetic, you've got a problem. However, there are different types of tests. And if you've ever been pre-diabetic or you've ever been pregnant even, you know that one of the tests that they have you do is like that 3-hour test where they give you something to drink and every 30 minutes, they check your blood sugar. They give you another shot of something. They check your blood sugar because they want to see over a given period of time how your body is responding to the insulin, because it's like pure sugar that you're drinking basically, right? They want to see how your body is responding to that sugary drink and how the insulin in your body is adjusting itself. And they can tell over time if your numbers are not quite coming down far enough within 2 hours, you're supposed to be down this far. Within 3 hours, there should be no trace of the insulin from that sugary drink in your system at all. There's another test for diabetics called the A1, hold on. Oh gosh. Hold on. I don't want to tell you guys the wrong name. And I've had to test this before. Okay, hold on. This one is called, okay. So they've got the regular blood sugar. This one is called the HbA. So normally we call it A1C, but it's actually HbA1c, right? Yes. And that particular test is testing your blood sugar over a much longer period of time, months. So what that test does is that actually gives you information about how over the last 3 months or whatever, your blood sugar has maintained itself. And so sometimes that test will be problematic in that it's showing that, hold on a second, you've got a problem here with your blood sugar, because over the long term, it is, over the past 3 months, your blood sugar hasn't really been maintaining itself at the levels that you should have, versus the regular test, which you just go in, have tested, it tells you in real time what your blood sugar level is. So depending on a number of factors, the regular test may be perfectly fine. However, that snapshot doesn't necessarily represent what has been happening to you over the past 3 months. And that is why people that they're very concerned about that you might be getting into that stage of being pre-diabetic, they're going to say, you know what? You need to start doing this A1C test. So start doing that, and we'll get an idea of over a 3-month period of time exactly how your blood glucose level is doing. So that's a meter or an indication of it over about a 3-month period of time, whether it's spiking or going too low or whatever, as opposed to the pre-meal fasting and post-meal, because sometimes they do that as well, glucose level testing. So it's the same kind of concept. And I only say that because I know a lot of people in our community are diabetic, and so they understand that really well. The different types of tests available for COVID-19 is the same thing. So the PCR test, which they stick up your nasal cavity, that one is going to tell you if you have it right now, if you have the virus present in your body. And the antibody test is trying to give you an idea of over the long term, have you had it? Because you may have had it, been completely asymptomatic, and no longer have the virus. And this will also help numbers. So that's why I was sharing that video at the beginning of the program in the UK, why they're also looking at pushing the antibody test, because it's also going to give them a more realistic indication of who has been infected with this virus, because they know the numbers are not accurate. right? Because a lot of people, again, are asymptomatic, not becoming seriously ill, and there would be no need otherwise for a physician to test them. So, of course, there are companies, laboratories around the world, or as the UK folks say, laboratories, who are looking to develop an antibody test. And the hope is to make this so simple and so easy that maybe people can actually take this test even at home. So the Swiss, this is breaking news as of 3:26 this morning, they have developed a test that they're saying is 100% reliable according to them on who has had the coronavirus, because it's 100% sensitive. So that means that 99.8% of the people who use it, it would be reliable. So there is a small margin for tests to come back as false positives. And the goal then is, if this is accurate, and of course this needs to be tested, to put this out there so that people can get tested as quickly as possible. Now, again, I want to caution you guys to understand what I'm saying. Right now, the medical and scientific community says that the information we have is inconclusive about whether a person who has already tested positive for antibodies means that they are immune to COVID-19, or whether they can get reinfected with the virus, or if they can pass it on. We don't know that yet. Ongoing research is critical. And this is why I caution people who post or who, have this herd immunity thing in their heads, that is flawed for this particular virus, because we simply do not have enough information. So we don't know, just because you have antibodies, that means you won't get it again. We don't know, just because you have antibodies means that you can't transmit it to other people, which would be almost the bigger danger, right? So you're walking around thinking, oh, you have all this protection. You don't want to wear a mask at all. You don't want to do all these other things, social distancing in particular, and you are still able to pass it on to other people. Having antibodies doesn't mean that you've protected yourself, and it certainly does not mean that you cannot pass it on to others as well. So the scientific community are working around the clock. I can tell you that they are working very, very hard. An antibody test would be a blood sample test that they would have to take. It's not sticking something up your nose. And they would actually, at this point, have to put it in what they call a centrifuge, which separates the serum, which contains the antibodies, from the rest of your blood. And then the machine adds serum to a small cup, and they do what they call chemical reagents. And we've heard these big terms used before. So they put a little bit of chemical in there, so that in the cup with the serum, so that they're able to test for its reaction. If they get a particular reaction, that means that if it turns like a light color or whatever, that means that the machine, which detects light, will know that you have antibodies present. Okay? And then the results are obviously sent back to your physician saying, yes, you have antibodies. Lots more for us to know and to learn about this disease. John says rashes on the tongue is the latest, and he thinks it's crazy that we have over 100 persons. Yeah. All employees should be tested before reopening, says Anne. I agree with you. The other Anne says, Sandra, take time for you. We need you. Yeah, like I said, this is just sinuses. Like, it happens in the morning. And I kind of go through these periods. I don't know if it's related to the weather, because I do know that technically we're in spring right now. So it could be something pollen related that's in the air. But normally by 10 o'clock, 11 o'clock, this is all gone and I'm like back to normal. That's why you never see me have this issue when I do the evening show. It's always in the morning. So I agree. Construction workers, we're obviously looking to be testing at least 40% of them. I say we test 100%, like honestly, test them all. Anne says, Sandra, thank you for breaking down the information for us to understand. Hope you feel better soon. Trust me, by 10 o'clock, this is all going to disappear. Sinus is no joke. I know, right? You need to steam some natural herbs. That is exactly what Miss Miriam recommended, and breathe it in as much as you can handle. And that's what I think I better start doing as of this weekend. I will start to, I don't have an inhaler at the moment, Annie, but sometimes when I do get a flu, I've had to, like most people, use an inhaler to kind of help with the whole breathing thing. But yeah, Sue, I've been to an ENT before and I kind of know what the issues are. It could potentially be actually some medication that I take that has a known reaction of actually inflaming your sinuses, particularly in the morning. And of course, irrigating my sinus cavities with saline, which I've been given, is helpful, but I'm a little bit like, it's hard for me to irrigate. Let me just put it that way. So normally I just like suffer through it. And then when it goes away, it just kind of goes away. But yeah, this morning it's a little bit more troubling than most. So just a reminder, folks, we're going to wrap things up here shortly. So Anne, I'm happy that I'm hopefully breaking this down enough so that people can understand exactly what we're dealing with. One of the things I wanted to say is on Monday, we're going to be wrapping up a little bit earlier. So I will still get up and do a morning show because I know that you guys look forward to it. However, my trial starts on Monday. I'm still waiting to hear if we're going to be able to live stream that, because that will be dependent on what the courts do. But yes, the trial starts on Monday. So we're going to have probably just an hour show. And then I'm going to head into another physical location to prep for the actual trial start time. So lawyer is working overtime to get everything prepared and ready to go. Some other parties are being shady with how they're handling the case, but you know how that goes. You've got to keep an eye on them. Sandy, on my worst allergy days, I find that NyQuil, day pills work fast. I know that horrible feeling. I live with horrible allergies. Try the NyQuil. Okay. Normally the is it Benadryl? There's one that's like a 24-hour pill. That one actually works really well. And what I should do is I should take it at night before I go to bed, so that when I wake up in the morning, I'm nice and clear. And maybe I better start doing that from this weekend. But again, I try not to take too many of these pills because they all have some sort of side effect. I mean, there's actual good data that taking allergy pills on a regular basis actually contributes to, oh gosh, what's it called? Dementia and stuff a little bit earlier in life than you should probably have it. Probably the last thing we want to hear, right? Claritin. Yes, I think that's the one that I take. And that one works really well because that's like 24 hours and bam, it's like, it works. Okay, folks. So listen, I'm going to wrap up. What I tend to do with the Vicks, I'll tell you how the Vicks actually works for me. Now, I know Caribbean people swear with Vicks for everything. And I do think that's funny. But one thing I do notice is when I put it around my sinus cavities, like right now I'm super congested, I do kind of just put it here and on my nasal cavity, and it just draws it all out a lot quicker. So for me, that's how I know the Vicks isn't curing anything, but for me, just having that, it's sort of like a way of irrigating without having to do the nasal irrigation directly, if that makes any sense. And I find that once I do that, the menthol effect of it all, I kind of am able to breathe easier. And I do have a natural Vicks one that I actually purchased. I need to tell you guys about that one from the agriculture show this year, which is completely all natural and homemade that a lady there was selling. And I do use that one on the baby and stuff as well because it's a little bit gentler. So whenever she's like congested, whatever, I put that one on her. But yeah, I find that medicated, rubs do help in terms of that as well. All right, folks. So lots of stuff always happening. There's breaking news right now from BBC Science that says immune clue sparks treatment hope. So it says that better understanding of COVID-19's impact on the immune system gives hope. An existing drug treatment might aid recovery. So this is coming out of BBC Science. We're going to keep an eye on what that's all about. And again, it's just constantly keeping up with information, reading the information, and seeing exactly what has been going on. So now they're finding that the most severe form of the disease have extremely low numbers of an immune cell called a T cell. And T cell clears infection from the body. So clinical trials will evaluate if a drug called interleukin 7, known to boost T cell numbers, can assist patients' recovery. So this is scientists from the King's College in London and Guy's and St. Thomas Hospital. And they have looked at immune cells in the blood of COVID-19 patients and found an apparent crash in the number of T cells. So now they're thinking if that's one response from COVID-19, maybe that's a clue on how they could potentially treat people who have COVID-19 by boosting the T cells in their bodies. Listen, scientists are working around the clock. I don't care whether you like people with money or you don't like people with money. It takes money to conduct scientific research. It takes money to pay doctors and scientists to do the things that they do. And so at the end of the day, I applaud everyone who's on the front line, nurses, doctors, police officers, even anyone who's serving on the front line. I want to take my hats off to them because they're putting their lives at risk every single day. There are people who are working in laboratories around the clock, trying to find either better treatments for COVID-19, or if a virus is going to come about, they're working around the clock to try to find a virus. So those of us who want to be back porch scientists, backseat drivers, whatever you want to call us, who can just sit in the background and think that this is all, a big joke. It's all a lie. We think that we understand, and we don't even, like that woman in the video, doesn't even have a good understanding of what an antibody is. Like, she totally doesn't understand it based on what she said. We do a real disservice to the scientists that are working around the clock trying to help us get over this situation. The coronavirus is not something that benefits anyone. This is not a virus where you can say, oh, this is only going to target certain people in our community. The reason why in the United States of America, there is a disproportionate number of African Americans and Hispanic Americans who are getting it and dying from it. It's not because the virus is targeting them any more than anybody else. It's that their existing infrastructure, their medical and social infrastructure, already has those people at a disadvantage. So any virus outbreak that happens, whether it's the HIV, the AIDS virus, whether it's this or any other big pandemic, disproportionately, oh my gosh, hold on one second, I can't breathe again. 1 second for me, sorry. But I do want to say this before we end the show. So give me 1 second. I'm going to put our muscle guy back up here while I blow my nose again. gross. Yeah, I'm definitely going to need some medical intervention today, i.e., an allergy tablet, because it's far worse today than it's been in a really long time. Yes. So my point is, what was I saying? In terms of, yes, in terms of, scientists working around the clock, I think that we should be trying to support those types of initiatives instead of us engaging in trying to be a, back porch physician, because we have not spent countless years training to be a physician. We have not studied viruses. We don't really understand a whole lot of the stuff that's going on, to be quite frank and honest. And the people who do and who spend their time, I mean, that's their area of expertise. We have to believe and trust them up to a certain point. Yes, do we blindly believe and trust everything? No, but you don't just become a person who becomes suspicious of everything for absolutely no reason. Like I've heard people say, oh, they're suspicious of Bill Gates. I'm like, okay, why? Because he's rich. Okay, and what else? I mean, that's it. Just because someone is rich, that gives you a reason why you should become suspicious of them? What? That doesn't even make any sense. The funny thing about Bill Gates is he has actually been donating money through his Bill Gates Foundation for eons. He is a philanthropic individual. So how he's become the boogeyman of the coronavirus theories, I think, is incredibly interesting. Why is he, as a billionaire, being blamed for the coronavirus? Or, we're pushing for a vaccine because of Bill Gates. Bill Gates has contributed to so much. And their particular area of interest or donations might be, medical, health, and social programs. But this is by no means the only thing that Bill Gates has ever been involved in or contributing to or whatever. So, I mean, go and look it up. You know what I'm saying? People want to blame this poor man for everything. The Gates Foundation has been around for a long time. They talk about that. They've tried to link him with Epstein, the child molester. The man has no connection to this man at all. So just because this man has money, he's getting blamed for everything, from creating the virus to, he's involved in wanting to get a vaccine. It's like, do your research on Bill Gates and the Bill Gates Foundation and see exactly how long they have been involved in things and how much they've contributed to saving lives around the world, not just in the US. And when you have read that information, then come back to me and have a good conversation about this. This is what I'm suggesting. Because people are ill-informed. They don't know anything about Bill Gates except that he's a billionaire and, that he's been around in terms of the computer world and whatever for a minute. Him and his wife actually, I'm sure they live a very comfortable lifestyle, but they're not even the type of billionaires that go around living lavishly. They would rather give their money away to other people, to see other people do well in life, and to try to cure communities from all sorts of diseases. So Bill Gates has been talking about, for the past decade, the lack of preparation and systems in place to deal with infectious diseases. This is nothing new. And there are people who've been talking about it a lot longer than him, like epidemiologists. And once again, no one was paying attention. The governments of the world were not paying attention. And so, of course, the average person now, it becomes really easy for them to blame somebody like Bill Gates when he has nothing to do with this. Oh, he created the pandemic because he's been telling people to be careful. Someone said this analogy. Conspiracy theories are claiming that Bill Gates somehow created this pandemic. Isn't that like blaming someone for causing a heart attack after he or she has warned you for years about such a possibility? Yeah. Always looking for someone else to blame, except really the ones who should be blamed, which by and large are governments around the world who has simply been ill prepared for any kind of a pandemic, whether it was coronavirus or otherwise. They've not had systems in place to deal with this at all. So suggesting that the man has ulterior motives just because he makes donations to organizations like the World Health Organization, for example, in my opinion, really is irresponsible, to say the least. Anyway, folks, lots more that we could discuss, but we are out of time. I wish you guys a wonderful weekend. And Wiz says there's a difference between experts and authority. It's better to trust experts and distrust those in authority. People who study viruses are experts. People in position of authority who don't know anything about viruses should be distrusted, especially those who are saying open up the economy. And I must say that I have to agree with you there. Oh, by the way, I forgot to mention this. It seems like we're back on YouTube. You guys know that we were off of YouTube for a minute there because somehow we got blocked on YouTube for, it wasn't even anything that we did, but it was, we shared a press conference on YouTube, and that press conference had some material or something in it that went against YouTube's copywriting. And so as a result, because we shared it, we got in trouble and they had us blocked. But I think now we're actually unblocked, which is weird. I don't like YouTube. I gotta be honest with you. And those of you who are watching via YouTube, we probably at some point will just be done with YouTube. But I think now we're unblocked again. So I believe that you can watch the show through our regular YouTube channel. We do have the stream pulling from Facebook to our website. So in any event, if you're unable to get to Facebook for some reason, or you don't have a Facebook or social media account, you can always go to the CMR website, CameronMonroe.com, click on live show up at the top, and then it will show you the live stream. All right, folks, before I call it a day, we do have Elvis McKeever from Cayman Brac. We want to give a big shout out to Elvis. He's not been feeling well. He actually got barracuda poisoning. So look at that. The second they open up the Brac to fishing again, somebody goes out there and gets some barra for him. And I guess they were so excited to have fish that they didn't test the barra because, you know, most people know that barra can be very, very dangerous, barracuda poisoning. And so what you want to do is, I don't eat barra very often. I think it is a nice tasting fish, but for me, it's not even worth the potential risk because I've seen people get so incredibly sick. They didn't die from it, but they became so ill from it and they suffered for 6-7 months from the residual effects of the barracuda poisoning. So I'm not up for that. So occasionally I might have it, but I always want to know, has this barra been tested? You know, and people tend to test it, I think, with ants, like they put it down, then they see if the ant die, then probably the level of toxins in that piece of barra is not something you want to be messing with. So our wishes go out to Elvis McKeever for speedy recovery. He was actually in the hospital from barracuda poisoning, but you guys know that last week we did a little test run with one of his live streams where we put it through. It's kind of after dark because a lot of his stuff is very adult oriented, very adult content. So we'll do that again around 10 o'clock this evening. So tune in for that if you want to hear what's going on in the Brac. And listen, it's just Elva's opinion on stuff. Nothing earth shattering. I mean, if you don't agree with him, you don't agree with him and you just keep it moving, right? But people find him entertaining. They do think he's interesting, and that sometimes he has some very interesting things to say. So we will post that one of his videos at 10 o'clock this evening. So if you're interested in that, please tune back in for that. We do want to speak about, I think Dr. Frank also has a very interesting show as well. So we're probably going to speak to him. You know, we want to make as much content available to you guys as possible. So someone just sent me a photo, it looks like here, of persons engaged, and what they're saying is no social distancing at all. Lord have mercy. Ay, ay, ay. Right in central town. And we'll post this up on the page here so you guys can see this. It's just unbelievable that people do not get it. I mean, what does the government have to do to tell you what social distancing means? And this is why they did not want to reopen money services business in particular. And I hate to say it, but normally the people who go to money services business are the ones who don't have the means to open up a bank account online. They don't understand online banking. They don't understand a whole lot. And apparently they don't understand social distancing either. And that's why the government knew that unless these companies had very strict measures in place, that they would have an issue. It's just a given. I'm not trying to be rude to anyone who goes to money services businesses, but when you see these people standing up on top of each other, what other logical conclusion can you come to except that they do not understand the importance of social distancing? Simple. We've got the evidence over and over again, whether it's in other countries where people send us photos, or whether it's right here now in the Cayman Islands, people right on top of each other. Security guard there looking like an idiot because he's not telling them, back it up, 6 feet, folks. You know, what are you going to do? It's an educational process. I guess we'll just have to continue it for as long as we can. All right, folks, I'm going to go take that Benadryl tablet. I wish you guys a wonderful weekend. I will be out and about on the road a little bit today. Even on my days to be out and about, to be honest, I try to keep it tight. Like grocery store, in and out, back home. Walk the dog in the neighborhood where I can get some fresh air with the baby. And that's the most that I'm going to do. I need to catch a little news here and there. I might go out and do a couple quick recordings. It's like yesterday I was doing a recording in town for the roadworks. And I had people coming up to me, oh, Miss Cayman Road, I need you to notarize the document. And I'm like, dude, back up. You're in my 6 feet zone. Back up. People are not getting it. I'm like, sir, back up. And no, I cannot physically notarize the document for you, but you can get it virtually done. So here's the number. Here's how that process works. Is people's like, no, man, I can just bring it to you. You can sign it. No, sir, I cannot, and I will not do that. I have a 3-year-old that I need to try to protect from this coronavirus for as long as I can. She does not need to be getting COVID toes or COVID ears or COVID anything else if I can help it. So I'm not interested in catching this and introducing it to my household. But even when I'm like backing up and I'm trying to keep my social distance, I see the dude coming closer to me and I had to just blatantly say, back up. 6 feet, sir, back it up. Because people just are not getting it. Rondine says maybe we just need to start saying physical distancing repeatedly. I don't know, honey. People are just not getting it. Anyway, folks, please enjoy the rest of your day. Anything breaking happens, you know where to turn for the latest news. We will definitely have it up on CMR. And again, big thanks to Alba Saku, who joined the program last night. If you guys missed it, you can go back on our social media page and have a look at what he had to say about what transpired earlier in the week in the Legislative Assembly. I'm going to go take a Benadryl, folks. I wish you a happy Friday. Please be safe. Those of you who can go to the beach today and tomorrow, be extremely safe out there. No beach activity on Sunday. Remember, Sunday is a non-alphabet day, so it is not allowed. And we'll see you guys here back on Monday, God's willing, for the morning show. Have a good one.